Hi, my name is Ruth Willis, and let me say, if there's someone here that's been affected by SIDS, I'm so sorry, and you have my condolence. I would like to take this time to talk about SIDS, which is sudden infant death. Some may not be aware that sudden infant death, crib death, and SIDS, they're all the same. I'm going to give you some information that might hopefully prevent SIDS occurring to your baby or a baby in your care. Sudden infant death syndrome, the unexpected sudden death of an infant under the age of 1 that an autopsy does not show explainable cause of death. SIDS claimed the lives of almost 2,500 children as infants in the United States each year, nearly 7 babies a day. That's terrible. There is no reason that has been found for SIDS. Babies are mostly between 1 month and 1 year old. For some reason, studies show American Indian, Black, and Eskimo infants are most likely to develop SIDS. The risk of SIDS also is affected by the maternal factors associated with pregnancy, including mothers under 20, and smoking cigarettes, doing drugs, or using alcohol, and inadequate prenatal care. The studies show that more babies die in the winter than any other time of year. Over the years, there has been studies to find the reason why SIDS happens. The studies show that smoking around your baby or smoking while you're pregnant puts them at a greater risk. Also, letting the baby sleep in the room that is not well ventilated, sleeping with its parents, these are bad. Many people think that the crib should be free of all items except a sheet and the baby. No bumper pads, no pillows, no comforters, no blankets. While the baby is sleeping to reduce the risk of SIDS, overheating the baby when it is sleeping, that can cause them to have SIDS too. Sleeping on their stomach, that has been associated with sudden infant death. Instead of covering your child with a big thick blanket or a comforter, just use a little sleeper on him or her. Here are a few ideas to consider when you have a new baby. You can place them on their back, give them a nice firm mattress in their baby bed, no blankets. And then the studies have shown that healthy mothers that breastfeed, it also decreases the chance of the baby having SIDS. They found that a pacifier can reduce the risk. I hate pacifiers. With all the technology we have today, we still can't explain why SIDS happens or how to prevent it from happening. As I said earlier, more babies die. Most often, more male babies die than the females from sudden infant death syndrome. Over 2,500 infants die per year. These women, they need to read up on SIDS. And then they need to know how to prevent their child from dying, if that's possible. So now we know there's some things to do to keep our babies from dying from sudden infant death syndrome. Mothers should not smoke or do drugs while pregnant. When the baby's born, don't let anyone smoke around it. No one knows why the babies of different ethnic groups are more likely, to die of SIDS. We don't know. Mothers, make sure to keep your doctor's appointments while you're pregnant. Most people fix their nurseries up beautiful. They have quilts and they have comforters, all these bumper pads, stuffed animals. Only now we know that's not a good idea. So, covering your child up with a quilt or a blanket can make them too hot. Just put a little sleeper on them. As parents, grandparents, even, soon-to-be parents, we want to do everything we can do to keep our children healthy and have long lives. So, I hope this information in some way helps. Thank you for allowing me to tell you about sudden infant death.